Hello, my name is Courtney Spees, and I will be doing the electrolyte imbalance clinical makeup case study. So I have EG. She's 73 years old. She came in. She was complaining of having the stomach flu, and she was lightheaded. So the first thing I'm gonna do is walk into the room and note if she has any lines, drains, like a Foley, anything like that. If she's on oxygen, which she's not, and then I'd also make sure that she has her call light in reach. She has her side table in reach. I'd also know what kind of position she's in, how many side rails are up, making sure her bed's lowered all the way. I'd also make sure that she has a clear pathway to the bathroom and to any exits. And I'd also make sure that she has her ID band and everything like that on. Okay, so the first thing I'm going to do is introduce myself. Hi, my name is Courtney. I'm going to be your nurse today. I'm going to ask her name and her date of birth before I do anything. I'm going to ask her where she knows where she is. I'm going to ask you, do you know what the date is today? Do you know what time it is today? So the first thing that I'm going to do is do her head to toe. So, first thing I'm going to do is have her turn her head to the right, turn her head to the left. Okay, no JVD is noted. I'm going to go ahead and do Perla for her. Okay, 3 millimeters, equal, round, and reactive. The next thing I'm going to do is look at her skin color. Her skin color is appropriate for her ethnicity. It's pink, warm, and dry. With elastic turgor. Her skin is intact. She denies pain right now. So the next thing I'm going to do is ask you to wiggle your fingers and your toes. Okay. And then I'm going to also check your pulses. Okay, pulses are present. I'm going to check cap refill on each finger. Cap refill is present. Okay, and then I'm going to have you push me and pull me. Alright, that's moderate. So the next thing I'm going to do is ask you if you've been having a cough. Says no. I'm going to have you sit up. Ooh, don't fall over. I set the scope in every time that you take a breath, or every time I touch you, take a breath. Alright, and now I'm going to do the same thing on the back. Every time my stethoscope touches your skin, take a breath for me. Alright, and then just take one deep breath for me. I'm going to put my hands like this. Her chest rises symmetrically. Raise your right arm. Use your left arm. While I do that, woo! I went ahead and inspected her skin on her back as well. Alright, you can lay down now. Alright, so you're complaining that you're feeling bloated. Your abdomen looks distended. When was your last bowel movement? And are you able to pass gas? Are you having any pain? Okay. So the first thing that I'm doing is inspecting her abdomen. Like I said, I looked and it looks distended. The next thing I'm going to do is auscultate her abdomen. Just being gentle, making sure I'm not putting too much pressure, hurting her. So her bowel sounds are present in all 4 quadrants, but they are hypoactive. I'm going to go ahead and touch your abdomen, okay? Just let me know if it hurts. Okay. So the next thing I'm going to ask you, are you having any painful urination, any discharge, stinging, burning, anything like that? No? Okay. And then, so the next thing I'm going to do is move down here. I'm going to go ahead and check her pulses on both of her feet. I'm going to look at her skin color down here. It's the same as up top. her pulses are weak bilaterally. I'm going to ask you to push and pull. Okay, so she had a weak push and pull bilaterally as well. I'm going to ask you to wiggle your toes for me. Okay, and then I do note that there is +1 edema bilaterally in both of her ankles. Are you having any like numbness, tingling, anything like that in your extremities? No? Okay. And so now that it's time for report. So Edie came in complaining of the stomach flu. She's on digoxin, captopril, furosemide, potassium chloride, and atorvastatin. She's been following a low sodium diet. She said that she felt bloated. Her vitals were 98.2, her pulse was 88, respirations 20, pulse ox 96, and blood pressure was 138/86. Her lungs were clear bilaterally. So I explained to her and her family that you should be looking for cardiac problems because hypokalemia is can cause cardiac problems like serious ventricular dysrhythmias. Since she's on furosemide and digoxin, I explained that we would be checking her electrolytes because it's possible that she could develop Digialis toxicity due to her hypokalemia. And then I also explained that while she's on furosemide, we have to watch because it could pull off large amounts of fluid and then pull off more potassium, which can also cause hypokalemia. Some diagnostic tests that we were doing were some blood testing for anemia, high cholesterol, and BNP, which is directly correlated with heart failure. We did her urine to check for kidney problems or diabetes. We did her ECG for arrhythmias, an echo for her heart muscle function. We also said that we'd be monitoring her vitals, we'd be doing her weight daily, we'd be monitoring her intake and output. We're encouraging bed rest right now since she's having muscle weakness. We're going to make sure that skin care is provided since she's probably going to be in bed most of the time. We don't want any skin breakdown to occur. We're also going to be monitoring her labs. We might be doing an electrolyte replacement of potassium. And then she's going to continue that balanced protein, low sodium diet. And then some instructions that I gave to her was that you need to monitor your fluid intake and output, and then I will also explain to you how to measure your urine properly. I would like if you could weigh yourself at the same time every day using roughly the same amount of clothes and the same scale. I would like you to monitor your diet and your fluid restrictions, make sure you're following those. It's just very important that you continue to keep taking a regular fluid intake, stay hydrated. Make sure that you're changing your position slowly because we don't want you to have orthostatic hypotension, get dizzy, fall down. And then I'd also like you to watch for side effects. And also, if any life-threatening side effects or you just feel like something's not right, just contact us, okay? You can always call. So that was really it for her. And yeah, so hope you have a good day.